Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great show for you tonight. I'm going to tell you it's talking about what if you had cancer? And what would you ask your doctor? We're going to cover that topic. But before we get into the main topic, remember, caring and sharing. Caring about yourself such that you take good care of yourself. We should be better healthcare consumers. Better healthcare consumers, so that we go to the doctor and take care of those. Well, remember what I used to call them? The med moments? Oh, you're with your girlfriends and you're walking up the stairs and you're like, hold on. I can't get up those stairs as fast as y'all can. I'm too short of breath and my knees are hurting. Those are med moments. Those are moments that your body's telling you that you should visit your doctor. Take heed to your med moments. Check it out. Don't ignore them, because it's one of those type of things. You remember the car commercial? Either you're going to see me now or see me later. Let those med moments take you right to the doctor and take care of it now. Don't let it become a chronic problem. Okay. I want you to look at our Facebook, our website, because there's so much good information. Remember, OBHealthy.com. That's the one you go to. It has a great amount of information, medical information, all kinds of good stuff that'll just make you more informed as far as your medical care and your health is concerned. All right, let's talk. Let's talk about diabetes just for a minute. Diabetes is a serious condition, and a lot of us have diabetes, or we know a family member or a friend that has diabetes. Diabetes is when the body does not produce or does not properly use insulin. And insulin is what controls our blood sugar. So when we don't have enough of it, our blood sugar goes sky high. Okay. Or when we have enough of it and the body cannot use it properly, our blood sugar still goes sky high. Alrighty? There are over 20 million Americans that have diabetes of some type or another. There are two types of diabetes. Type 1 is called insulin-dependent diabetes, and this usually occurs in juveniles, meaning that it happens a lot of times when you're a child and you have diabetes for the rest of your life. And these particular patients, they are the ones that can't produce the insulin, so we have to give them injections of insulin because they can't produce it. There's type 2 diabetes. Type 2 diabetes is non-insulin dependent diabetes. And what that means is that those people, they produce enough insulin, but the insulin does not work. It does not work at the cellular level. So we have to give them medicine. So there are different types of medicines that we give. They usually don't have to have injections of insulin. They usually can take medicine. And this is usually an adult onset diabetes. Alrighty. What are the signs that you may be, diabetes may be a part of your medical problem? Okay. Frequent urination, always having to go to the bathroom. Excess thirst, meaning that you're always drinking water. For some reason, you're just always thirsty. Unexplained weight loss. For some reason, weight just fell off and you have no reason. You weren't on a diet, it just came off rather. Extreme hunger, always kind of hungry. It's like, boy, I just need something to eat. I'm always nibbling. Alrighty. Vomiting sometime. And vision changes, definitely, because you can affect the eyes with the amount of glucose or the sugars that are in your blood affect the certain liquids in your eye get very viscous and you can't see very well. All right. Dry skin or feeling tired even. And wounds, they don't heal very well. Okay. And infections, you get infections very easily. These are some of the signs that there may be a problem with diabetes and you should see your doctor. Okay? Understand that uncontrolled diabetes can cause death or disability. All right? So it can be very serious. All right? So prevention, what is the key? Regular physical activity And maintaining a healthy weight can really improve diabetes. And that's especially for the people that have type 2 diabetes. Okay. So that's what I wanted to talk about today as far as our, just a short clip on diabetes. As far as our main topic tonight, what we have is we're going to talk about cancer. All right. And we're going to talk about it in a way that, well, if I just got diagnosed with cancer, what do I ask that doctor? Boy, what do I say? What do I want to know? I need somebody to explain this to me in a way that I can understand. That's what we're going to talk about tonight. I have the perfect person to talk about this topic. His name is Dr. Kevin Clark. He's a surgical oncologist. That's a big word, I know, but he'll explain it all to you. Dr. Clark, welcome to our show.
Thanks for having me back.
Oh, yes. Well, I was going to get you back because you're probably one of the smartest people I know, so I got to keep coming. I got to keep you coming back.
Thank you.
Okay, so this is a tough topic, but I want to cover it in a way that everyone out there really understands. You know what I mean? And not that you can get comfortable with it, but at least you can come to a point where you can talk about it and you can feel comfortable enough to ask the questions that you need to ask so that you can get the appropriate care. Cancer is one of those words to me. Cancer is one of those words that once it's said, and it's said about you, it strikes fear from the top of your head down to your toes. It's one of those words that just, So I want to bring it home, bring it down. Let's just talk about it in a way that we can better get people to understand, and just not that they have to feel comfortable with it, but in a sense that they feel easy enough that they can talk about it. All right? So let's step back for a minute. What is cancer? Tell me what this is.
So cancer really, it's a growth, and it's a growth that is uncontrolled.
Right.
That's really, at the basic level, that's what it is. It's part of your own cells, and it could come from any organ that has lost the ability to regulate itself. So what happens, it grows, and it doesn't stop growing, actually.
Right.
And in addition to growing, it has the ability to go to other parts of the body and cause problems. So essentially, it's two components. It grows and it spreads. Okay. And really, that's what cancer is. It's uncontrolled growth, and the tissue goes from one part of the body, say it goes from the lungs or a better example, it goes from the breast to the lungs, from the breast to the bone, from the colon to the liver. So that's what cancer is.
Okay. Why do the cells go haywire? Is it because, they just all of a sudden woke up that morning and said, I'm not going to act right anymore?
So what happened in the normal process of cell turnover, so cells are constantly dividing.
So we're always making cells.
Always making new cells.
All right. And for all those years, like I'm 50 years old, and for 50 years I've been making normal cells, and all of a sudden one woke up one morning and said, I'm just not going to act right.
Actually, it happens more often than we think.
Oh, okay.
But so what happens as a cell divides, there's what we call checkpoints. There's certain things to ensure that when that cell divides, it only divides once, and it differentiates. It does one function. So
differentiating means that a liver cell should do liver things.
Correct.
A heart cell should only be heart, you know what I mean? It should work on the heart. It shouldn't be able to jump down to the liver and do liver things. You understand what I'm saying?
Right. So when in the process of that division, cells lose the ability to regulate that function, now they can divide uncontrollably. When they do that, they also don't have the ability to do the normal function. So it's two components to it. It's the division and the growth.
Right.
And now they actually acquire other abilities, and they seep through, and they get into the bloodstream, and they go to different parts of the body, and they cause destruction and problems that we all know is a hallmark of cancer.
Right. Right. What do you think Do we actually know what causes cancer? I mean, for instance, lung cancer. I'm a pulmonologist, and we know it's puffing and puffing and puffing, and they say, oh, cigarettes going to cause. But do we actually know how that chemical in the cigarette caused that cancer?
Yes and no.
Okay.
So we know there's certain things called carcinogens.
Okay.
And the chemicals in smoke.
Right.
Also, there are other environmental chemicals that we know have a direct impact and can cause cancer.
Okay.
But the actual process of development of cancer is very complicated. So it's not one step or one thing that causes it. It's a combination of multiple things. So as I mentioned before, even though cells are constantly dividing in our body, the development of cancer actually it doesn't happen very often. And if you think about it, should happen more frequent because cells are constantly divided, but it's a very, it's an inefficient process actually, which is good. Otherwise, everybody would have cancer.
Right.
But it's very complicated, and that multiple things have to happen for that cell to progress and become a cancer cell.
Okay. Okay. How is cancer diagnosed? I mean, for the basic part, when do you how do you figure out somebody has cancer?
So there's two ways. So we know at certain time points in life, your risk of developing cancer goes up. So as we get older, for instance, men have a risk of getting prostate cancer. Women have a risk of getting breast cancer. If you smoke, you have a risk of getting lung cancer. So we screen at a certain age in certain groups to try to detect the cancer before it becomes symptomatic.
Right, right.
Once you have symptoms, and symptoms could be pain, it could be obstruction, it could be bleeding.
Right.
Usually the cancer at that point is advanced. So you try to diagnose cancer in the early stage by screening.
Right.
And we screen based on age groups, the risk factors, so on.
Okay.
But if you have an unexplained cough that lasts and you're a smoker, then you need to get checked.
Right.
If you have bleeding, if you have rectal bleeding, blood coming out of anywhere that it shouldn't, essentially has to be checked out.
Yeah, you need to be checked.
Unexplained weight loss.
Okay.
So if you've noticed that your appetite's the same, but all of a sudden you've lost 20 pounds, that could also be a sign. Unexplained fatigue. So there are subtle things also that it can present in subtle ways that if you're not feeling well and you have some of these symptoms, you have to get checked out.
Right, right. So. You said something, and I don't know if there's an answer to this. I really don't. You said that there are different things that can happen that you may trigger that you have a higher chance of getting cancer. Number one is age.
Right.
Now, to me, if we're producing new cells, and those are baby cells, and they're brand new cells, then why at 20 years old that new cell doesn't get cancer, but at 80 years old it's still a new cell and it does get cancer? That just doesn't make sense to me. And I don't know if there's an answer.
Yeah, that's a good point. I think you've accumulated. It has to do also with the accumulation of or the interaction of the body with the different chemicals and toxins that you're exposed to over a lifetime.
Over a time
period.
Right.
You have certain changes. So at 26, you may not have the same. You certainly don't have the same exposure as you do at 80. So if you're exposed to smoking for a longer period of time, your body has that much more time for these mutations and changes to happen to produce the cancer. So even though the cells are new, and it's the same new cell at 20 and at 80, that cell or the body or the tissue is exposed to carcinogens for a longer period of time. And also, what can happen sometimes, you don't have to be exposed to smoking or anything else. You can develop cancer just from mutations that happen during the normal divisions of the cell.
So mutation, that's a big word for me.
Right, mutation. So all the cells have DNA, and DNA is basically directs what the cell does.
Right. It's the code.
It's
the code that the cells follow to produce what they're supposed to do what they're supposed to do and produce what they're supposed to produce or be what they're supposed to be.
Exactly. And what happens as a cell divides, that DNA can become what we call mutated. Or
like a mutant.
Change.
We understand mutant.
Right.
Teenage mutant ninja turtles or whatever. Yeah, we understand mutants.
So it can change.
Okay.
And some of those changes can, if they're significant, can lead to cancer. Now, the body has checks that regulates those changes. So whenever it happens, it gets fixed.
Right.
Whenever it happens, it gets fixed. But when that system breaks down, and it breaks down over time also, you develop more mutations, and as you develop more mutations, the risk of developing cancer goes up. Okay.
Why are there so many types of different cancers? You know what I mean? It's like can every organ get cancer? I mean, you know what I mean? Like, it's like endless, isn't it?
Right. So basically, as you have different cell types, you're going to have different cancers.
Different cancers.
Now, the cell types or the tissues that have more division or turnover will have a higher chance of getting cancer.
Oh, all right.
So tissues that don't divide as much won't have as high a risk. So, for instance, the majority of cancers that we see are skin cancers, actually.
Right.
Because skin's constantly turning over. It's a high turnover rate. Colon cancer, it's a high turnover rate in the mucosal lining.
So that's the inside lining of the colon,
right.
So that turns over a lot.
Turns over a lot.
It's always making new cells. Boom, 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 and
right. So, for instance, you'll have over 200,000 plus cases of colon cancer, whereas something like a cancer from the muscle or sarcoma, there's only maybe 50,000.
Okay. So a big difference.
Right. So different parts of the body, different tissues certainly has a potential to develop cancer, but the incidence is different. And it's based on how fast each of the different sites are turning over or dividing.
You know, you just brought up something very interesting and that I haven't thought about in a long time. There are certain aspects or certain parts of the body that they don't replicate that often.
Right.
And then other parts, they're always making new.
Right.
It's interesting. Very. Tell me about treatment, cancer treatment. What are our options here?
So I think, so just to go back, when somebody has cancer, as you mentioned before, and when I often have to give that diagnosis initially, it's a life-changing event within seconds.
Oh.
And you realize anything you say after you tell somebody you have cancer, I don't think they hear anything else.
Yeah.
So the discussion usually happens in stages. So once you do make the diagnosis and patients are ready to hear what you have to say, it's staging and then treatment. So with cancer, we have to figure out what stage it is. In stage, there are different ways to stage, but stage really is a way to describe how extensive it is. So is it in one spot? Is it in multiple spots? Is it something that we can cure? Is it something that we can't cure?
Right.
So the stage kind of gives us an idea of how to treat it. And then once you've figured out the stage, the next step is treatment. Now, treatment for cancer used to just be, well, historically, if we're going from the 1900s, and as cancer treatment developed, it was mainly surgery. Then as we developed chemotherapy and radiation, those things were added in. Now chemotherapy drugs have expanded. Now we have different agents that are more specific. And then the different techniques of radiation have also improved. And we combine all of these things to best treat the cancer. Now, each cancer is different. So breast cancer is treated differently from colon cancer, from lung cancer. And the stage really dictates how you treat it. So for instance, if you have early stage colon cancer, the treatment involves removal of part of the colon, and then maybe additional treatment.
Okay. When you say early stage, you mean the doctor actually caught it early. It was only in one place, and it hadn't spread, and it was a little small area. That's what you mean by early stage.
Right. So, important thing you have to know, in order to know what treatment you're going to get, you have to know the stage.
Okay.
Because those two things go hand in hand. Surgery is an integral part of cancer treatment.
Okay.
And surgery basically is removing the cancer, physically taking the cancer out. So whatever organ it is, if it's the lung or the colon, it involves physically cutting it out, essentially. Radiation involves basically cleaning up that local area where you do surgery, to sterilize that area. And now chemotherapy is designed to kill whatever cells are left behind, or to kill the dividing cells that are in the cancer. So you combine. Sometimes you do one, sometimes you do two, sometimes you do all three. Sometimes you do chemotherapy first and surgery. Sometimes you do surgery first and chemotherapy. It all depends on the cancer type and the stage.
All right, and how that particular cancer is going to respond through past history of treating that cancer. That's how doctors have determined how to treat the cancers.
Right. So
for
we've
best
done
response.
Clinical trials, large clinical trials, looking at different treatment options and compare them and see how patients do. So we always take the better option. So we're constantly doing clinical trials to update the different options to make sure that you're constantly getting the best therapy possible.
Okay. So I just want to key on this one thing. You brought it up, the fact that when a patient comes to your office and this diagnosis is given to them for the first time, they don't usually hear. Should they bring a friend or a family member or a minister or somebody that they have confidence in with them?
Absolutely.
Okay.
Absolutely. You should. It helps in terms of support, for one, and it helps because there's things you're not going to hear again that the person next to you will hear. And it's important at that very moment to have somebody there with you. It's a very difficult time, as you can imagine, and it's always good to have support. So it could be anybody, just somebody that you trust that it can be there with you.
Should you write your questions down?
Absolutely.
Before you get there?
Absolutely. I've had so many experiences where patients come in and say, I had all these questions to ask you. And once they get there, completely forget. So I encourage them to write everything down. And nothing's a stupid question or nothing's a silly question, because it's brand new to them. And it's important that they understand what's going on, what the diagnosis means, what the therapy means, so that they're comfortable. And the only way that you're gonna get to that point is if all the questions you have, all your concerns are met, or addressed.
What about nutrition? Now you got this information. I know at a cellular level, everything's kind of going crazy in your body, and your body's probably, knowing the body, it's trying to fight this thing. Nutrition, how important is it? I mean, to start eating healthy, eating well, eating enough protein, enough calories, so that you have the strength to help fight.
Absolutely. It's nutrition for sure. So a healthy, balanced diet will help you get through the treatment, and you will do better if you're nutritionally replete. Also, state of mind. So how you are approaching it, if you're, I won't say in good spirits, but if you're positive, you have a positive outlook, that has also a tremendous effect on how you do also.
I know you're a surgeon, so I want to emphasize, not emphasize, but I want to capture what you do. Tell me how surgery helps and what you see after your surgery, you know, how the patients fare and how they do.
So surgery, it's the fastest way to remove the tumor.
Okay.
And in a lot of cases, you can cure with just surgery. So that is the main treatment and sometimes the only treatment that you need, and the cancer will never come back.
Oh, excellent.
So patients, and again, this is mostly with smaller cancers or early cancers.
Okay.
And the patients do very well. Again, depending on what operation and what organ we're talking about, the disability that you have with surgery is a little different. So if it's a lumpectomy for breast cancer, that's a different operation than a liver resection for liver cancer. So how you do depends on the stage and the type of operation and the extent of the operation.
Okay, all right then. You know, the thing of it is that this is such an important topic, and this time went so fast. My goodness, it's at a point where we're going to really have to stop at this point.
Okay.
I'm just so happy that you've come and you've given us, you know, at least a light as far as and giving us a window to look at what it's all about from your side, and then portraying that to the patient side as far as cancer and answering your questions and being comfortable and bringing somebody with you so that they can hear and so that, you know what I mean? It's just so important. So we just may have to do a second show on this one.
Sure.
Yeah, we definitely. So Dr. Clark, thank you very much for coming in. Yes. Well, another show, another ending. Boy, oh boy, it went fast. All righty. In closing, remember sharing and caring. Caring about yourself so that, guess what, you can do better as far as your health care, and you can share that greatness, that information, that how I'm doing healthy with everyone else so that they will be inspired to go to their doctors as well. Remember, www.obeyyourdoctor.com, and look at our Facebook, Obey Your Doctor. It's all there, and we're doing so many great things on Facebook. Check it out. Never institute any change in your medical care until you consult your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.